Cook.
Hey, did you check out Nina's personalized logo on her kiteboard?
Yeah, she got the little she-devil thing. Got it on her knee brace. The girl's happening.
Very cool. I'm sure we'll be seeing more of her in the future, and kiteboarding probably.
Absolutely.
Well, he's a weekend warrior in the truest sense. A San Francisco man opts for major knee surgery just to save his active lifestyle. Tiff Tyler has the story from the Bay Area.
Just look at him. He cycles, he snowboards, and he lives life to the fullest, despite almost 20 years of chronic knee pain.
When I was a kid, prior to 1979, 16, 17, I used to race motocross and do a lot of other things that kids do, I guess. Indestructible kid. And I damaged the meniscus in my knee, and by the time I was 18, I had a hard time walking, and it was really, really bad. Constantly a lot of pain.
Now at 41 years old, Henry Marks has had 4 major surgeries on his right knee, the first as a teenager.
So the best thing they did in those days, they just did a meniscectomy, and they took out the whole chunk of medial meniscus cartilage. And I struggled with that for about 18 years, and it finally got to a point where it was eating away at the bone, the articular cartilage. And I was in another predicament if I couldn't work.
Henry saw 3 different doctors. One even recommended a knee replacement, something he definitely didn't want to do. Finally, in 1995, a visit to the Stone Clinic in San Francisco gave him hope.
Yeah, Henry's goals were clearly that he wanted to become athletic again. So our goal, given how young he is, was to rebuild his knee biologically rather than with artificial materials.
And this is the first doctor that asked me what I wanted to accomplish. And so I told him my goal then was to save my knee. I didn't want to do anything but save my knee so I could walk and work.
Dr. Stone suggested a knee reconstruction using a technique he developed back in 1991.
We've now done about 180 patients with this, where we harvest cartilage and bone from inside the knee where they don't need it, take it outside of the knee and make it into a paste, and put that paste back on to this worn out area inside his arthritic knee. And that permits us to regrow this surface, and then to protect this regrown surface, we replace the meniscus cartilage so he has a shock absorber.
So Henry's 3rd knee surgery gave him some cartilage grown from his own tissue and some donated.
Started racing bicycles again, snowboarding, jumping, backpacking, packing all kinds of weight, doing everything I love to do. And with my family and my wife and my daughter, I have an 11-year-old daughter, and it just made life completely turned it around.
That reconstructive surgery was in 1997, and perhaps you're wondering why on earth is Henry in Dr. Stone's office now?
Unfortunately, when he was playing with his child and running down a hall a few weeks ago, he did a hyperflexion rotation injury, tore that meniscus allograft, but fortunately he tore it in a way that we were able to sew it back together.
So this is repair surgery number 4 on the same knee.
Can we take the stitches out yet? Or?
Yeah, but if we take him out today and the knee falls off, we have to start over.
If Henry wants to get back on the slopes or back on his bike, the best medicine Dr. Stone can prescribe right now is lots of physical therapy.
We think the rehab is key to the surgery, and so we'll only operate on patients who will agree to the rehabilitation program that we prescribe.
There you go, go.
So even with 4 operations, lots of exercise and determination will help the knee and the man enjoy a healthy, active life.
I want to ride my bike. That's what I really want to do. Be able to work, ride my bike, and do things with my family. You know, whether it's running on the beach, you know, or backpacking. We go backpacking up in the Sierras every year. I want to do those things.
Reporting in San Francisco, I'm Tiff Tyler.
Henry Marks is relieved he'll be able to ride his bike and stay in shape. But once the knee feels good again, I'm sure it'll be hard to turn down another weekend on the slopes.
In competition, injuries happen. It's